While many professionals use the terms continuing education and continuing professional development interchangeably, they represent different processes. Let's talk about how they differ and why it matters for pharmacy professional practice. First, let's take a moment to acknowledge the land that we live, work, and gather on. SCPP offices are on Treaty 4 territory, and staff and members across Saskatchewan are on the territory of Treaties 2, 4, 5, 6, 8, and 10, the traditional land of the Cree, Dakota, Dene, Nakota, and Saulteaux peoples, and the homeland of the Métis. As we continue on to discuss our development as pharmacy professionals, let us not forget that reconciliation with the traditional peoples of this land should be forefront in our minds when we consider how we can best serve our patients and their unique needs. By the end of this presentation, you should be able to identify the difference between continuing education and continuing professional development, describe why a continuing professional development model is beneficial, and identify the 5 steps of the continuing professional development cycle in SCPP's revised Competency Assurance Program. First, let's start with defining continuing education, which is likely familiar to you. These are the learning activities that help you stay up to date with knowledge and skills needed to practice. These activities have been defined by the Accreditation Council of Pharmacy Education as activities used to support professional development in order to maintain and enhance competence. They are typically measured by continuing education units, CEUs, and are a time-based credit with 1 hour usually being 1 unit. This includes both accredited and non-accredited activities. There are many examples of CE, including online courses, conferences such as the annual conferences hosted by PAS, CSHP Sask Branch, and RX Files, Canadian Pharmacist or Pharmacy Technician in the letter CEU, workplace presentations, independent study activities, and many more. What these activities have in common is they're all intended to teach you new or expanded knowledge or skills. These are a very important part of how pharmacy professionals improve their competence and therefore their practice, but they are only one part. There is evidence that shows that many of these types of activities, while they can help to improve our knowledge, they're not effective at improving our practice when they're done alone. This brings us to some steps that are missing or done ineffectively in CE, and just some of the reasons why we are encouraging professionals to complete the full CPD cycle. First, think of 1 or 2 activities that you documented last licensing year or so far this year. Ask yourself, how did you choose this activity? Evidence would say that most of you are thinking of factors like convenience, cost, or whether this was already an area of interest for you. Instead, these activities should be targeted towards a gap in practice, an area that you really need improvement in for them to be most useful. And that's one of the limitations of CE. Now, some of you may be thinking that you did seek out a specific activity that would target a gap in your knowledge or skills, and that's exactly what we want to encourage. But we want to make sure that in doing so, we give supports to ensure that your assessment of gaps is accurate. As another limitation of CE is that unguided self-assessment has been shown to be often inaccurate. Finally, thinking back to the learning that you have done over the past year, has all of it been incorporated into your practice? Do you know if it has had a positive influence on practice? Again, this is an area where some of you may be able to think of examples, but many may not be sure what that would mean or how you would measure an impact. When completing CE alone, there is an assumption that expanded knowledge will lead to behavior change in practice, but it has been shown that's not necessarily the case. In CPD, as we'll discuss, this is done more intentionally rather than being assumed. Due to the limitations of traditional CE, many organizations, including the International Pharmaceutical Federation, encourage pharmacy professionals around the world to engage in a more robust process called continuing professional development. This is described as a cyclical, ongoing process and has been recommended internationally since 2002. Since then, specific components have been recommended, including self-appraisal, creating a learning plan, implementing a learning plan, and evaluating the impact. These steps have been combined in different ways and have had different language used for them, but all are built on the concept of quality improvement principles in science. This brings us to the 5-step CPD cycle used by SCPP. The steps include an assessment of practice, planning for improvement, learning, applying learning as well as changes to practice, and evaluating the impact this has had on your practice. To get a better understanding, let's talk about each step in a bit more detail. First, we assess our practice. Here's where we identify areas we need to work on in order to focus our time and attention. Rather than learning what's most convenient, we want to make sure that we're getting the most valuable use of our time by targeting areas that need the most work to benefit our patients, ourselves, and those around us. This may include completing a structured self-assessment, such as one based on the NAPRA Standards of Practice, to help you choose one that you need the most work on. It could be attending a learning activity, such as a conference, where a certain session identifies that you have some additional learning to do in a specific area, like an introduction to new guidelines. This could also be in the form of a problem that comes up at work that you're unsure how to address, and you then want to focus learning activities on how to address this more efficiently or effectively when it comes up again. It could include getting informal or formal feedback from patients, peers, colleagues from other health professions, etc., and using this feedback to focus on areas for improvement. It could also be getting data about practice, such as running a report to discover the most frequently dispensed medication in a community pharmacy and determining if there are areas for growth in our knowledge about that medication. And there are many more examples of how assessment of practice can be done. Next, we need to make a plan to target the area of practice that we have identified. This starts with SMART goals. This process helps ensure we are targeting specific improvements, planning how we will measure when we've gotten there, making sure that the changes we want to make are attainable and we aren't biting off too much at a time, making sure our plans are relevant to benefit us, our patients, our colleagues, and others, and establishing a time frame that we're working within so we know when we'll remeasure our success. You will then need to decide what learning is needed and what practice changes are needed in order to meet this goal. Next, you need to build the knowledge and skills required. This includes the same type of activities that are currently being done as continuing education. CE can, in many ways, be considered the learn step of CPD. Many articles define the most effective types of learning for practice change, but they often reference learning that is interactive, practice-based, that includes problem solving and feedback from an instructor. The next step is to apply our learning to practice. In CPD, this is a purposeful step that is planned, done intentionally, and can be guided. It includes making practice changes based on learning and targeted to address the problem identified. And it also includes collecting any data that will be needed to measure success based on SMART goals. This also includes the steps sometimes listed in CPD cycles of documenting the changes. We then intentionally evaluate how the changes made affected our practice. This includes determining if goals have been met and deciding on next steps. Even if goals weren't met, there is benefit in assessing why that is in order to improve the process the next time. We can also identify further gaps or related problems that should be addressed. This can then lead to the start of a new cycle on a similar or a different topic. These steps make up the full CPD process. The 5 steps together on one topic we'll refer to as one CPD cycle. It is important to consider that while each of these steps may be present informally along with continuing education, depending on the situation or the professional, completing all of these steps purposefully and intentionally is CPD. Evidence shows that when pharmacy professionals are given education and provided guiding tools about this process, they're able to complete each of these steps more confidently, and the impact on practice is increased. So now we have identified that while CE is one important step of CPD, it doesn't suffice to support the full process, and there is evidence of limitations when used on its own that CPD attempts to address. CPD is a more robust process where all of these steps are purposeful, can be guided, and given credit. This diagram is one part of the SCPP Revised Competency Assurance Program framework that has been published in Microscope and Scope articles and is available in more detail on the SCPP website. At this point in the presentation, it should look familiar to you as it goes through the same steps as we just discussed, but provides more detail and shows how this process can be built onto with additional guidance for practice quality data and structured feedback that will help you assess your practice. Visit the SCPP website for more information and updates on the practice quality data and structured feedback programs. Thank you for your time on behalf of the SCPP Competency Assurance Unit. And here are the references used throughout this presentation.